talk when you're up to talk, and then talk.
All right.
And then you rotate.
Good morning. Welcome to the past, present, and future of SNAP, Improving Innovation and Success in Employment and Training Programs. I'd like to say good morning and welcome to today's Nutrition Subcommittee hearing. Thank you to everyone for being here, and thank you in particular to our witnesses for your participation and valuable insights. We're continuing the series of hearings looking at the past, present, and future of the Supplemental Nutritional Assistance Program, or SNAP, by examining employment and training, or ENT programs. While we know that a job is the surest way to get out of poverty, it can be difficult for individuals to find a job that matches their skills or to gain the skills needed to fill the jobs available in an area. This is why Congress created employment and training components in various welfare programs to help low-income individuals obtain the skills and training they need to find and keep a job. SNAP ENT and other workforce training programs exist to ensure that the safety net is a temporary stop for able-bodied adults. They build up valuable skills. They lend a helping hand to those bouncing back from adversity. Each state SNAP ENT plan is approved and overseen by USDA. States are required to operate a SNAP ENT program and have considerable flexibility to tailor their state's program to their specific needs and economic circumstances. Among the services SNAP ENT programs offer are job search training, work training, educational programs, and job retention. Some states operate their programs with mandatory participation while others make it voluntary. Some coordinate their workforce programs through one central agency while others are more separated. Recognizing the transformative impact that a job can have on someone trying to lift him or herself out of poverty, the 2014 Farm Bill authorized SNAP ENT pilot projects to test innovative strategies. In March of 2015, the USDA awarded 10 state grants that carry rigorous reporting and evaluation requirements in order to ensure quality and evidence-based information. We're fortunate to have representatives from 3 of the 10 states here with us today. Though the final evaluation of the pilots is not anticipated until 2021, today's hearing will be useful to learn what factors influenced each state's pilot design, what strategies are being tested, and how these states intend to utilize the pilot results within their core ENT services offered by the state. I want to close my remarks with one final point. Our safety net programs are indispensable, but for those that are able to work, the safety net should be a temporary stop and not a final destination. This is something that has been echoed by Republicans and Democrats alike. In his second State of the Union address, Franklin Delano Roosevelt told Congress, quote, "Work must be found for able-bodied but destitute workers." He extolled not only the obvious financial benefits of a job, but also the benefits to the mind, body, and spirit as well. And while President Roosevelt took a government-centric approach to create jobs, the core principle behind it remained, if you can work, you should work. Today, we'll examine programs that help those who can work, secure, and keep a job, and look at new, innovative approaches to make these programs more effective. I thank each of our witnesses again for being here, and I look forward to hearing from you. I would now like to recognize Ranking Member McGovern for his opening statement.
Thank you, and I want to thank Chairwoman Wolosky and for convening this hearing. And I want to thank all of our witnesses for being here today and to share your experiences and findings. I'm looking forward to hearing about these pilot programs. As I understand it, there's a lot of innovative work being done and perhaps some ideas that we can draw upon in the future. We need to remember, however, to look at these pilot programs in terms of the bigger picture. Education and training is funded by a block grant of $90 million per year. This funding level hasn't been updated since 2004, and SNAP ENT funding is extremely limited compared to the number of recipients who could potentially be eligible for services. And I think it's important to note that some states aren't even using all of their grant funding. I point this out not to be critical of these jurisdictions. I know there are a lot of pressures on states, but there are gaps in funding, and we know we aren't reaching everyone who needs assistance. In fact, while there are about 44 million people receiving SNAP benefits, only about 3 million are served by SNAP ENT programs. And with the ABOB waivers expiring, at least 500,000 able-bodied adults are being kicked off of SNAP. A lot of these individuals lack education, are unskilled. Many of them are veterans who are returning to the United States after serving our country and trying to get reoriented back into life here. But without adequate ENT program funding, I'm not sure what happens to them. Given the diversity of the SNAP population, I think it is important to underscore that there isn't a one-size-fits-all solution. And I'd like to remind my colleagues of the testimony Secretary Vilsack gave this committee in 2014, that the pilots are an important component to helping SNAP recipients towards self-sufficiency, but they are only one tool states can use to engage this high-risk population. I also appreciate hearing that the states testifying before us today use case management to achieve successes in their programs. But I'd like to remind members of the subcommittee that case management costs money. We need to provide our states with the resources needed to continue the good work in this area as well. And so I'm pleased to see states taking innovative approaches to these education and training pilots, and I look forward to learning more about how these programs can help our most vulnerable neighbors. I also just want to point out, yes, we are all dedicated to trying to help able-bodied people be able to get employment and to get a job. But we also need to understand that a big chunk of able-bodied people who are on SNAP right now work. And one of the challenges is, finding a job that actually pays a livable wage. So contrary to the perception out there that everybody on SNAP doesn't work, that's just not the case. We have many, many, many recipients, the majority of able-bodied people who do work, who work hard to support their families, but still earn so little that they need to rely on SNAP. So I look forward to the hearing, and I yield back my time.
Thank you. The chair would request that other members submit their opening statements for the record so the witnesses may begin their testimony, and to ensure that there's ample time for questions, the chair would like to remind members they will be recognized for questioning in order of seniority for members who were here at the start of the hearing. After that, members will be recognized in order of arrival. I appreciate members' understanding. The gentleman from California, Mr. Costa, is not a member of the subcommittee, but has joined us today. Pursuant to Committee Rule 11, I have consulted with the ranking member. We're pleased to welcome him to joining the questioning of the witnesses. Witnesses are reminded to limit their oral statements to 5 minutes. All of the written statements will be included in the record. I would like to welcome our witnesses to the table. I now recognize Ms. Delbonnay to introduce our first witness.
Thank you, Madam Chair. I'm very pleased to introduce David Stillman from my state of Washington. He is the Assistant Secretary of the Economic Services Administration in Washington State's Department of Social and Health Services, where he is responsible for a number of Washington's public assistance programs and benefit programs. David oversees more than 4,000 employees, 80 offices, and a $2 billion budget with a focus on transforming government to better serve families in need. Prior to accepting his current position, David served for over 5 years as director of the department's Division of Child Support. Among his achievements is he is a 2001 recipient of the Governor's Distinguished Manager Award, the highest recognition for a state's government manager. And David received his BA from Whitman College and his JD from the University of Puget Sound School of Law. He truly does excellent work on behalf of so many, and I'm just thrilled that you're here with us today. Thanks for joining us, and I yield back.
Thank you. We also have Mr. John Anderson, Deputy Director, Georgia Division of Family and Children's Services, Office of Family Independence, Atlanta, Georgia. Welcome. I would also like to yield now to Mr. Costa to introduce our final witness.
Thank you very much, Madam Chairman, and thank you for the courtesy of allowing me to participate in this morning's subcommittee hearing. I am honored to introduce Mr. Pete Weber, a friend, a gentleman who I've known for many years, retired in 2001 to dedicate himself to community and economic development for people who live in the San Joaquin Valley. Mr. Weber is the founder of the Bridge Academy, which was recently selected by the United States Department of Agriculture as one of the 10 national pilot programs that we're going to be hearing about this morning, aimed at increasing income and self-reliance of families eligible for food stamps. He makes a compelling case, I know, because I have visited the Bridge Academy many times. His work with the Fresno Bridge Academy led to the James Irving Foundation Leadership Award last year for creative and inspirational leadership benefiting the people of California. I've had the pleasure of knowing Pete for many years, as I've said, and come to respect his involvement in many of the various segments of our community. And for so many reasons, I want to thank him for that dedication, to, in today's testimony, those who are challenged and who have very difficult economic circumstances they're faced, and trying to provide a helping hand through the SNAP program to improve their lives and make them independent. And so we'll look forward to his testimony.
Thank you, Mr. Costa. Mr. Weber is also accompanied today by Ms. Kim McCoy-Wade, CalFresh Branch Chief, Department of Social Services, Sacramento, California. Thank you to all of our witnesses. Mr. Stillman, please begin when you're ready.
Good morning, Chairman Walorski and Ranking Member McGovern, and thank you also, a gracious thank you to Representative Del Bene for her introduction. In Washington, under the leadership of Governor Inslee and with the support of our congressional delegation, we've elected to make TANF, SNAP, and the SNAP education and training programs part of our WIOA state plan. I begin there, and hopefully you'll have the chance to look at the slide that's been put into your slide that it looks a little bit like a superhighway. I think that it's really important to note that with Congress's help, we've been able to push a reset button on how we deliver our workforce system support services across the entirety of what we do and how we do it in Washington State. The WIOA priority populations intersect and overlap with those populations that we serve with TANF and SNAP and so many other parts of our program. In fact, we're really happy to be able to work with our Departments of Commerce, Vocational Rehabilitation, the State Board for Community and Technical Colleges, our Department of Labor equivalent in Employment Security, and really through that combination of SNAP education and training and the other parts of our basic food program, put this effort at the center lane of our superhighway to focus our attention on the alleviation of poverty. So that's my set of sort of bureaucratic on the top statements, but I'd be remiss if I didn't mention or begin with more of a client-centered perspective. So I'm going to talk about Taylor. Taylor is a single mom with 2 kids. She enrolled into the Basic Food Employment and Training Program in Seattle, part of the Seattle Jobs Initiative, one of our stellar community-based organizations, and the Highline College in the fall of 2012. I hope you'll pay attention to this anecdote. She was working as an LPN, barely able to make ends meet, and through the support that she received at SJI and Highline Community College, she was able to complete her program and receive services such as transportation, required school items, and utility assistance. She took some time away to help a parent, an ailing parent, and was able to re-enter the program and is now working 32 hours a week at $26 an hour plus benefits. So what do we take away from that? We should take away that life is not seamless, and that is so true for so many of the clients that we serve. It's also a takeaway that there's a need for the availability of coaching and career navigation services, support service funds, and that Taylor's success is equally attributable to the efforts of the local community investment that is involved in the SNAP education and training funds. I'll quickly make reference to the second slide that I provided, which shows how there is skin in the game, dollars in the game that are invested from the local level on up to draw down these important federal funds. This is not about a state bureaucracy, although many of the funds are needed to build and sustain infrastructure. This is about local dollars matching federal dollars in order to build a really important and critical program for the clients that we serve. In addition, Washington's been blessed as being one of the 10 states awarded a grant under the recent Farm Bill where we're testing some additional innovative approaches for work registrants that receive SNAP. Our pilot, Resources to Initiate Successful Employment, or RISE, is using that rigorous gold standard evaluation and a randomized control process. We intend to increase engagement in unsubsidized employment opportunities, increase participant earnings, and reduce reliance on public assistance by using comprehensive case management, the ability to attend training and participate in the soft or work skills referred to in our state as strategies for success, and the opportunity to engage in work-based learning opportunities, yet another opportunity for us to partner with our WIOA service providers in Washington State. I'll finish again with another client story. JP entered RISE with high barriers, homelessness, chemical dependency, mental health, a criminal record, and a lack of a driver's license, just to name a few. with the case management support that we were able to provide, and as a result of assistance from an unexpected source, the Division of Child Support, JP was able to obtain regular visits with his son, who he had not had contact with over 5 years. He has now secured sobriety housing, reduced the barriers that have allowed him to engage in strategies for success training, and is on his way, this is a work in progress, to earning a chemical dependency professional certification and engaged in an internship program. I invite you to think about what the takeaways are there with true system integration and SNAP E&T at the heart of that service delivery. Thank you.
Thank you, Mr. Stillman. Mr. Anderson, begin when you're ready.
Madam Chairwoman, members of the committee, thank you for allowing me to speak to you about the receipt and use of this education and training grant. Our division believes that everyone that can work should work. We developed this grant proposal in coordination with our Georgia Department of Labor and local workforce investment agencies. In our traditional education and training program, we focused our efforts on the able-bodied adults without dependent children, or the ABOD population. Prior to a statewide waiver in 2009, we ran our ABOD program under the mandatory option. The old ABOD program was extremely cumbersome to administer. It took time to hire staff, train them, and let that staff gain proficiency in their jobs, and that usually coincided with the ending of the program in that county. Georgia had always used a county-to-county based approach. These counties that we served were drastically different from year to year. This inhibited us from being successful in developing long-term relationships with organizations and community partners that could assist us with getting the ABODs employed, and most importantly, keeping them employed. Our ABOD placement activities at that time consisted mostly of in-house functions such as filing, answering phones, janitorial services. Our focus was to get the ABODs to meet the work requirement and not get them into long-term employment that led to self-sufficiency. With long-term job placement in mind, we applied for this education and training grant to more comprehensively assist our ABOD population. We looked at how the medical community approaches comprehensive care management to find ways to address the source of why an ABOD was not able to gain and sustain employment. We have several levels of assessment for each ABOD, and each assessment is validated and expanded upon to ensure that we've addressed all their barriers. The barriers to employment must be addressed if we are to be successful in our goal of getting ABODs to self-sufficiency. These barriers include, but are not limited to, a lack of education, substance abuse, mental health issues, and others. We understand that these individuals need hands-on, coordinated, intensive services to address most or all of their barriers. We also knew that relationship development with other state and private organizations was key to the success of our pilot. We have worked diligently to develop these relationships within our pilot counties. The importance of coordinated case management services to the success of an ABOD cannot be underestimated. On the human side, it can be scary for some ABODs to make new relationships. Our customers develop professional relationships and trust with our staff. I received an email from one grant participant on Friday of last week that expressed her thanks to our staff. She described her anxiety and uncertainty of attending the program orientation. After attending the orientation, she felt inspired and now has a sense of hope about her future. The grant has allowed us to target market trends and jobs that will lead to long-term successful employment. Coordination with our technical schools and certificate programs are included. Initially, our grant was to serve those who had been unemployed for 12 or more months. We saw very quickly the need to expand that to any unemployed ABOD was essential to our success. So we're now serving all ABODs that are selected for the pilot. With the pilot implementation, we completed a phased rollout. As of July 1st of this year, all pilot counties are fully operational. And even though we're just a few months in, we're already seeing some great outcomes. We've been able to place 60 ABODs in a variety of jobs, some of them starting at $12 an hour, and some go up to $20 an hour. One population that we did not anticipate to serve in our grant was drug felons. On July 1st of 2016, Georgia removed the restriction of drug felons from participating in the SNAP program. Our Department of Corrections and Pardons and Paroles have some valuable reentry programs. However, coordinating with employers that are willing to take a chance on a felon is problematic, leading the ABOD to a dependency on SNAP. Thus far, we've been able to assist at least one parolee gain a $12 an hour job and is no longer receiving SNAP benefits. In closing, I want to thank you again for this opportunity to speak to you and the funding that you made available to states to try innovative programs like this that will help us move more people to long-term employment and self-sufficiency. Thank you.
Thank you, Mr. Anderson. Mr. Weber, please begin when you're ready.
Madam Chair, our ranking member, members of the committee, thank you so much for giving us the opportunity to provide this testimony. And Congressman Costa, thank you for your kind introduction, and in particular for your devoted support of the Fresno Bridge Academy. The Fresno Bridge Academy is a program of Reading and Beyond, a nonprofit organization in Fresno County. It has been operating since 2010. In 2012, Reading and Beyond partnered with the Fresno County Department of Social Services to focus its attention on lifting SNAP beneficiaries out of poverty, and to do so in a way that generates positive returns for taxpayers. Prior to the start of the ENT pilot in January of this year, the Fresno Bridge Academy had enrolled more than 1,200 families in the program, and by the end of last year, we had graduated more than 800 of those families. About 75% of those families entered the program unemployed. The rest of them were underemployed. About 81% of Academy graduates have achieved success, meaning that they either obtained employment or significantly increased their wage income if they entered the program unemployed. 85% of those placed in employment retained their jobs a year later. And importantly, within 18 months of enrollment, 30% of those enrolled had achieved full self-reliance, meaning that they had over-incomed. The Fresno Bridge Academy is a unique two-generation program that works with all members of a family to overcome any and all barriers to employment. I want to acknowledge that self-selection contributes to the success of the program. The Bridge Academy is an all-voluntary program. People don't have to enroll. They don't have to remain enrolled for the 18-month duration of the program. They do so because they are motivated to improve the prospects for themselves and their families. Let me give you an example to help illustrate how the program works. When USDA Undersecretary Kevin Concanon visited the Fresno Bridge Academy in December of 2015, he met a family that was comprised of a man, for confidentiality purposes, we'll call him Jose, his wife, who we will call Maria, and two teenage sons. They were both unemployed. They both had criminal records. They had one car. Jose had to come to the Fresno Bridge Academy for the most part using his bicycle. Their children were struggling academically. By the time the Undersecretary met with them, the Bridge Academy had worked with Jose to get him trained as a warehouse technician and helped him land a job as a forklift driver in a manufacturing company. We had worked with Maria to help get her criminal record expunged. We had worked with the two children. Both of the parents had undergone a number of life skills workshops, including how to manage a household budget, while their public assistance dollars were diminishing. Now, that was 20 months ago. Today, Jose is still employed by the same company. He has received 2 promotions. He's now working, he's now receiving a wage of $15 and change per hour in a county where the average wage is about $21 an hour. This is a job with benefits. The family is completely off public assistance. The oldest son just graduated from high school and has joined the Navy, and the youngest son has a 3.6 GPA. We have 800 more success stories like that. And as Paul Harvey would have said, here's the rest of the story. For every taxpayer dollar invested in the Fresno Bridge Academy, the program is returning $5.50 back to the taxpayers. We know that because Fresno County contracted for the development of a cost-benefit model that measures the economic impact of the program, not only on families, but also on taxpayers. We call it the Fresno Bridge Academy ROI model, a document that describes the methodology used to do the ROI calculation has been delivered to your committee staff. And I realize I am running out of time, and so I am going to tell you more about the ENT pilot during the Q&A portion of the meeting.
Thank you, panel. So we understand that each state operates. I don't think Ms. McCoy, you didn't have a statement, correct? Okay, thanks. We understand that each state operates a SNAP employment and training program. Can you three just quickly talk about each of your state's core ENT program and what services are offered across the state, including how you engage recipients to begin with? And Mr. Stilm, I'll just start with you if you could quickly summarize that.
Thank you very much for the question, Chairwoman. The core of the program really is focused through a partnership with community-based organizations and community colleges. In Washington State, we were very fortunate in the mid-'90s to have some very creative folks who came together in the Seattle area to build a relationship between the nonprofits, community-based organizations, and the community college to meet a need for clients who were leaving TANF still on food assistance, and our mantra is get a job, keep a job, earn more money. In that context, they were leaving public assistance, but not really succeeding in terms of having a family wage job. So our legislature, and of course with the support of federal funding, we took the opportunity to spread that across the entire state. The core of our program is in each and every community college with foundational relationships and with the community-based organizations and nonprofits.
Thank you. And Mr. Anderson, and specifically, how did you engage recipients?
We engage our recipients. We send out letters to them, and we have orientation that they come in and we explain the workfare program and how to comply with that. We have one county where we have a contract with our Goodwill that has 10 certificate programs that that can help employees get to jobs that can help them gain a good long-term employment. It's voluntary, and so the participation in the voluntary program is disappointing to us. We started, for example, in the beginning of January 2016, we had 6,100 ABODs receiving in the 3 counties that we were operating in, and at the end of the expiration of the 3-month time limit, we were down to 2,590 that were actually participating in jobs or workfare that could allow them to continue to receive benefits.
I appreciate it. And Mr. Weber as well, kind of like just really quickly the core, but also how do you engage recipients?
Sure. We are place-based. We have 9 academies within Fresno County. The County Department of Social Services gives us the contact information for every single SNAP beneficiary within those neighborhoods. We then call them, invite them into a meeting in which we discuss the program with them and then enroll those who are interested in signing up for what is an 18-month program. The core services are comprehensive. We provide everything from education support to employment training to life skills training, and we also engage the children. We have a separate source of funding to engage the children so that we are addressing the family holistically.
I appreciate it. Mr. Anderson, just a real quick follow-up. We know that each state can require mandatory participation of SNAP recipients subject to the work requirements. However, the majority of states offer voluntary participation. What factors did Georgia consider when implementing mandatory participation in both the core ET program as well as to test mandatory participation in the pilot projects? Can you just speak about that?
Sure, I'd be happy to. When we traditionally we ran the program prior to 2009 as a mandatory program, and participation even at that time or success rates were fairly low just because we didn't have that coordinated services, I think, to address all the barriers that the ABODs may need. In 2009, we switched over to a voluntary program, as all states got a waiver with that. And we were beginning to see, in those areas that there was a need to change our focus to not just helping them get to the work requirement and it's to more of helping them get self-sufficient, find jobs that could become self-sufficient. As part of our grant, we were able to look with our other partner agencies that focus on work to try to find ways and emerging market trends and jobs that would be becoming available for these types of individuals that don't have college degrees to get certificate programs or some vocational training that can help them get into good-paying jobs.
And then just quickly, how do you interface, Mr. Anderson, with TANF, for example?
With the TANF program, we currently separate our we have siloed thinking on that. Our TANF program focuses more on families with small children and trying to help the pregnant women and parents with small children get employment. And then on the E&T grant, we've always focused on the other side of the population of those adults that don't have children to try to focus that area. They've been siloed thinking in the past. We have started thinking more about, as we look at the employment services side of it, a lot of the basic job responsibilities and functions are similar on developing resources and trying to help individuals address barriers. So in one of our pilot counties, we have started looking at combining the supervision, not mixing the responsibilities of the actual employee, but combining the supervision of the TANF employment services staff with the pilot county education and training staff so that we are maximizing our resources.
Okay,
in both
I appreciate it.
programs.
I'll have to stop you there. And I recognize Ranking Member McGovern for 5 minutes.
Thank you. This is to Ms. Wade or Mr. Weber. As you know, SNAP has a 3-month time limit for adults not raising minor children. If those individuals cannot find a job or a qualifying job training program within 3 months of receiving SNAP, then they are cut off. States can waive the time limit in areas with high unemployment. California is currently taking advantage of the waiver. Presumably, that's been important since some parts of your state continue to have unemployment that exceeds 10%. Now, some in Congress have called to end the waivers altogether. What would that mean for California? Do we provide you with enough funding to create qualifying work slots for this group, and can they find them elsewhere, or would some individuals who are willing to work be cut off of food assistance?
Thank you, Congressman, for the question. Yes, in California, we are anticipating the end of the waiver in parts of the state in about 18 months, and we are engaged in a lot of planning on that because we do think the rule will be very harshly felt by families, and it's very complicated, frankly, to administer accurately. No, we do not have enough jobs and enough job training and enough job slots. We are currently very excited that about half of our counties currently have a voluntary E&T program, and as of October, 8 more are coming on, so we are growing our capacity, but not nearly enough to meet the hundreds of thousands of folks in California who are working and are looking to improve their skills.
Now, some of my colleagues have called for TANF-style work requirements in SNAP. Could we accomplish the kinds of innovative programming that you provide under a TANF work requirement framework in SNAP? And what do you think of that approach for the SNAP program?
Well, we're learning from our colleagues in Washington that the best approach really is to put skills and training at the front of the line and give folks that work experience that allow them to have a long-term, life-changing path to better wages and a better career. So that's the model that we're going for. What's that assessment up front, that case management, that barrier reduction that puts them on a path to sustainability?
Yeah.
If I may add to that, Congressman, and this is a perspective from a business person. I'm a retired CEO of a couple of companies. I would rather hire somebody who wants to work rather than somebody who's being forced to work. I would also suggest from a taxpayer perspective that an investment in developing the skills and capacities so that people can develop get a job and sustain that job over time is a very important consideration for this committee.
Thank you. Let me ask another question. Ms. Wade or Mr. Weber or Mr. Stillman, I mean, low-income adults can face a lot of challenges to finding a job or finding a job with advancement opportunities. Two of the biggest problems I hear that people have are with transportation and affordable child care. Without those in place, even skilled workers can find it hard to take and keep a job. Can you tell me if these are concerns, real concerns for your clients, and give us some examples? And SNAP E&T gives states federal matching funds to provide transportation and child care for people in job training programs. Is that important, and could we do more, and what would you recommend to Congress on that front?
So I could not recommend more highly the utilization of resources to address transportation issues. After housing, transportation is really the second highest cost center to a struggling family living in poverty or living on low wages. And it's really critically important that we consider those challenges. Even in a place like Seattle, which has some wonderful public transportation, going north and south is great. Going east and west is not. And so we have to take into consideration, even in a community like that, where we can see the benefits of mass transportation, that there are transportation challenges that exist for our clients. I'll finish by saying I was remiss in not talking about how many clients we have. 21,000 clients avail themselves in Washington State, and one of the ways we do address that is through having an integrated service delivery system. So the child care, for example, that you referenced, I completely agree that it's necessary for families to have access to child care along with all the other supports. Fortunately, in Washington State, we deliver those services relatively seamlessly in an intake process that includes TANF, SNAP, child care, and even some of our Medicaid programs. So we have the opportunity to interface with our clients in a single setting and then plant the seed. If you're on TANF but leave TANF, don't forget there's SNAP ENT in your future.
Mr. Weber, Ms. Wade, any?
I would, thank you. I would concur with that. Let me explain. In Fresno, we have 9 sites, 6 of them urban, 3 of them rural. Particularly in the rural communities, transportation is really, really critical because the availability of jobs is constrained. As to child care, it is the single funding issue that we struggle with the most. It's a real problem.
Thank you. Thank you.
Thank you. Congressman Benishek, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Mr. Weber, I was kind of interested in this multi-generational thing, how you engage the whole family. So, I mean, what are you doing with the kids? Man, that's the first thing that pops in my mind, you know.
Yeah. Let me. When a family is enrolled in the Fresno Bridge Academy, we do 2 assessments. One assessment is of the head of household to see what kind of vocational training, what kind of education they need. A lot of these people don't have high school degrees, so we have to do GED and so on and so forth. And then we try to connect that to jobs that are available in the current economy. What are their aptitudes, interests, what vocational training can we deliver to them? The second assessment is of the family as a unit. What are the family's issues and needs? And with regard specifically to the children in the family, our focus is primarily in 4 indicators. Are they reading at grade level? Are they doing math at grade level? Are they getting exposure to the arts? Are they showing up for class? If they are not, then we will work with them, refer them. We have referrals. We work with 175 different service providers in Fresno County to deliver all kinds of services to adults as well as to children.
So it's making sure the kids get to school.
We work to make sure that kids get to school. Let me explain, Congressman, that our first conversation with a family that has children is always about the children. It is about the children and how they are doing. Because in the end, we have to motivate the adults in the family to want to work. And if you're going to motivate them to work, the best way to do that is by encouraging them to think about the future of their kids. And then you turn the conversation to how do we help you become the best possible role model for your children. That's our approach.
And that seems to work then?
It works very well. More than 80% of our families are finding success.
These are the people that come to you, though. This is they pretty much have to come to you? Or?
We call them and then invite them to an orientation meeting and then explain what the program is. We ask them to make a commitment for 18 months. Now, we generally place them in jobs, most of them, within the first 6 months, but we stay with them because we want to make sure that the outcomes are sustained.
How many people that you contact end up participating in the program?
It's a difficult question to answer because we get the contact information from the county, we make the calls, and then oftentimes, the numbers are no longer good, the people aren't there,
What about the
you get an
people that
answering
actually
machine.
show up for one visit? How many of those people end up staying for participating in the program?
About 77% of the people who come to our orientation meetings sign up.
Well, no, I appreciate your work in this, and frankly, having a private-public partnership, to me, is really the way to go, because with most of these comprehensive services, there are people in the community that are better attuned to helping those folks than the feds, frankly. So I really appreciate the work that you're doing and the opportunity to learn more about it. So what's the obstacle for having do this more widely through the state? Is it simply the funding? I mean, is most of your funding then coming from the ENT funds that are provided?
It is, we are funding constrained. We think that we ought to be able to do that, what we're doing. We're currently expanding, what we've expanded into a second county. We're going to expand into 2 more counties in October of this year.
So how much money exactly are you spending then in Fresno? I mean,
We
what
spend-
is the amount you're spending to do
This-
this program you're talking about?
This is going to be probably a little extraordinary, but our cost per family is $1,800 per family over 18 months. The reason we are so cost effective is because we access every possible service available to families through other organizations, through community colleges, through the ROP programs, through the WIOA, through countless nonprofit organizations. One of our 8 core principles is we don't duplicate anything that already exists. So we are very, very cost effective, and that's the reason we're able to produce such a high return for taxpayers on the investment of taxpayer dollars.
All right. Thank you very much,
Yes, sir.
all of you, for your testimony today. And Mr. Weber, I'm out of time. Thanks.
Thank you. I recognize Congresswoman Delbene for 5 minutes.
Thank you, Madam Chair, and thanks to all of you for being with us today. I get to brag a little bit about my state today because Washington State has really been a true leader in ENT programs. In May 2013, I introduced the Enhancing Employment and Training Through Education Act, a 3-year competitive grant fund to encourage states to provide targeted employment and training programs similar to what we've had in Washington State. We had a very successful program called Basic Food Employment and Training, what we call BFET. And this bill was the basis for the SNAP ENT pilots that were in the Farm Bill. As many know, ENT programs differ widely in participation and success, and even at the height of the recession, 60% of those enrolled in Washington's BFET program found employment, and in one study, less than half remained on government assistance 2 years after the program. This is the kind of success that Washington State's produced and the kind of success we're all hoping for to see in these pilots. Helping people find good paying long-term employment in a high-demand industry is the best way to ensure that everyone has access to economic opportunities. And these investments we make not only have an incredible effect on our economy, but also on people's lives. So I thank you so much for all of the work that you're doing. Mr. Stillman, you talked a little bit in your testimony about this, but can you expand on what we've learned from the BFET program, the original program that informed the new pilot program that we have, RISE, and what you look forward to learning from RISE that we can use going forward?
Excuse me. To reiterate just a bit, I think what we've learned from the original program is that community engagement matters, and the phrase that I used earlier, having skin in the game, matters. So those are things that bring together that alchemical combination of local partnership, local educational partnership, local community-based organization partnership, employers, and industries in a way that's completely different than a top-down administered program. And it is really that opportunity, I think, that we're trying to leverage as we look at the experience of our clients in that prior program. Just because we're super proud of what we did before doesn't mean that we didn't take note of the the, let's say, 35% or so of the clients who were still struggling within the program. And we looked at things like housing, we looked at the criminal justice involvement, we looked at transportation, and recognized that there are some things in common that we really need to focus our attention on if we're going to lift everyone up through that process. Just as a closing note, as your comments referenced, even during the post-recession time, we had some wonderful success. The last slide that I provided all of you shows a cohort of progression from that 2009 timeframe forward, and it is really building on that experience, building on what we've learned about the needs of families, the needs of individuals, whether they're ABODs or families. How do we deliver tailored and unique services that also align with sector needs, business needs in a way that can help grow the entire economy and grow families.
And why do you think some states fail to make use of all their E&T funds? And what difference has this made for Washington State?
Boy, commenting on why other states won't take advantage of that is a challenge for me. Perhaps I should start by saying thank you, because in some odd way, the failure of other states to take advantage of that has meant that we've had more opportunity in some instances to draw down some additional resources. That's a sad commentary, I think, in terms of a loss. I would say, if I were trying to put on the hat of a state that hadn't done this, I think it's that sometimes we get caught up in simply trying to deliver services within a silo. We're going to do TANF, we're going to do SNAP, we're going to do child care, we're going to do Medicaid, we're going to do all of these things together, and we fail to have a view of the client across that set of systems and really understand that life does happen to our clients, and we need to be able to deliver those services in a much more braided way. But day-to-day demands of a bureaucracy and service delivery can be extremely challenging and very difficult to pull back and see that big picture.
Thank you so much. I'm running out of time, and so I yield back.
Thank you. Mr. Crawford, you're recognized for 5 minutes.
Thank you, Madam Chair. Appreciate it. You know, the culture today, we put an awful lot of emphasis on a need for a 4-year degree to be successful in this country, and unfortunately, I think we do that to the detriment of our youth. But we've got a huge gap as a result in technical and vocational jobs that are good-paying jobs but aren't being filled. So I'm wondering how you, and this is to all of you, I'm wondering how you are using E&T programs to meet the job needs within your state and communities in light of the gap in skills in vocational occupations. Anybody wants to weigh in on that?
So if I may, I would be happy to jump in. My role at the Department of Social and Health Services, I have the advantage of sitting on the local, the Washington State Workforce Board. As part of the Workforce Board, we've adopted not just college-ready, but career-ready as part of our thinking. And it really speaks to that point that you brought up about vocational readiness, community college certificates, and other gateways or doorways to employment and to success. We need to be less narrow-minded, if you will, about how we prepare our students in middle school, high school, and even into apprenticeships and other non-4-year college settings. That is a critical part of what we need to do. Once again, by being part of a larger system and talking about this from the perspective of the individual and the family, I think we can see those opportunities and see where a single focus on a 4-year college education is really a disadvantage to this larger group of people.
Anybody else want to weigh in on that?
Sure. In California, just 3 comments. Certainly, one of the fastest growing components for us is vocational training and certificate training. That's absolutely a growth area for us. Second, we have a new agreement with the community college system in California to make sure the community colleges and E&T are a bridge. And third, by joining our WIOA folks at the table, the WIOA plan in California specifically says tailored to the local and regional job market. It's not a job to nowhere, it's a job to a job in your community. That's very much a core part of our planning.
Thank you. Appreciate that. You know, one of the other things that we hear repeatedly, at least in my district, is the decline of soft skills in the workplace. I wonder if you might weigh in on soft skills development as possibly as a pre-employment type of a workshop or something along those lines, because we hear that repeatedly from our employers because they feel like, you know, we can train this individual ourselves, but the soft skills are not being modeled appropriately. So, we talk about mentorship programs or pre-employment. Can you comment on that?
Yeah, you're absolutely right. We hear that repeatedly from employers in our area. We can train the hard skills, just give us people who will show up for work and so on. They love people coming out of the Fresno Bridge Academy because they've already shown that they'll show up for training, that they will, that they've got some motivation. And so that's why our people are sought after. Let me also address your earlier question. One of our 8 principles at the Fresno Bridge Academy is what we call our ABC approach. And the ABC approach is get a job, then get a better job, then get a career. We're talking about people often who don't have high school degrees. So they're not going to get 4-year degrees before they get employed. We want to get them into a job, but a job that has upward mobility. And then continue to upgrade their skills so they get a better job, and all of this is aimed towards a career. So we start from the family up. We start with, what are their interests and aptitudes and so on, so that this is going to stick and they're going to want to continue to advance their skills.
Excellent. Mr. Anderson, did you want to comment on that?
Yeah, we in Georgia, we've never focused on a 4-year degree. We understand a lot of these folks, and as Mr. Weber said, they don't have high school diplomas. So we developed a contract with our North Georgia Goodwill Association, and they've helped us with 10 career pathways to help people get certificates, and some of those include advanced manufacturing operations, production technicians, electronic assembly and soldering, floor installation, custodial, forklift training, general construction and highway safety, those types of jobs that people don't have to have degrees for. So we haven't ever focused on 4-year degrees because we believe there are jobs out there, if they're the right kind of job, that can get them self-sufficient quickly.
Excellent. Appreciate it. Mr. Steele, I'm going to give you the last 20 seconds.
Thank you. Well, I would like to point out that we sometimes think of things as being sequential. Get a job, I don't need any more help. And so in relation to your question about soft skills, one of the things that we try to focus on is problem resolution even after employment, so that we can offer that sort of coaching that, hey, you didn't show up to work today. Hey, you're not getting along with a coworker today. How can we help you? How can we help you keep that job? It isn't just getting a job, it's keeping that job and then building on that success in order to achieve that long-term career goal. So you are exactly right to wonder about the need for it, and it is important that we then support the resources we need to make that happen.
Thank you. I appreciate it. Yield back.
Thank you. Mr. Costa, you're recognized for 5 minutes.
Thank you very much. Again, I want to thank the subcommittee because we're really talking about setting the groundwork here for the next Farm Bill and how we try, hopefully, to come together in a bipartisan effort as we look at reauthorization of the SNAP program and the WIC program. And this testimony, I think, is important, setting that stage. When we first looked at reforming welfare in the mid-1990s, I remember very clearly in California that we were struck that to the issue of employment and training and how many of the folks that we were trying to help didn't have the necessary educational standards. I mean, they didn't have the high school diploma. And so we had to spend the time providing that education so that they could then step into the training, so that they could then have the opportunity, so meaningful job placement. To Mr. Weber and Ms. McCoy-Wade, I know that the complete evaluation of the employment and training will not be finalized before the next Farm Bill, but we will have some preliminary data that we can refer to and look to expand the program. But given that you are already producing these, I think, very good, positive, significant outcomes, shouldn't we be investing now on programs that have been shown to generate such positive social and fiscal benefits?
Well, Congressman Costa, the answer in short is yes. Most of us, I think, have read Moneyball on government, and we want the rigorous kind of analysis that is being made available through the ENT pilots, but those results are not going to be reported in full until 2021.
Well, and that's part of the challenge, because we're going to be putting together, we hope in the next year, 18 months, the Farm Bill, and a lot of predeterminations are going to be made.
So we know that there are lots of people out there who want the kind of assistance that we can provide, and so anything that can be done to provide added funding. We are not constrained by by people's interest in this program. We're
right.
constrained by funding.
Ms. McCoy-White, because a couple other questions I want to ask before my time expires. No, go ahead. You want to comment on
I was just going
this?
to add that we do know something about what works in job training, both from the Bridges Academy work before the pilot, but also from our TANF programs and from the Recovery Act funding of subsidized employment, in particular, giving employers extra incentive to take a chance on some of these employees with limited history, more barriers, maybe some soft skills challenges. So I think there are things we do know and can invest in before.
In your department, looking at the Fresno Bridge Academy and doing evaluation, obviously, I think it's a very extraordinary program that improves lives and gives an opportunity to become independent. Based on your calculations that the $5.50 is being returned to the taxpayers for every taxpayer dollar invested, how much of that savings do you think in the outlays for SNAP benefits takes place?
The direct benefits out of the $5.50 to the SNAP program is $1.51. $1.83 is attributable to the fact that people are now paying income taxes, whereas before they were not. And the rest of it is a combination of a number of different factors, including, for example, the benefit of having a GED and what that means in terms of lifetime earnings and taxes paid and so on.
We obviously think that you're doing a terrific job, but how, when we look at, clearly in Washington State, you've done some very groundbreaking work, I believe, but how much of this is, in terms of the firsthand evidence on the program, in improving lives of some of the poorer families in our communities, is this program being able to be replicated?
Well, we started, as you know, Congressman, in 2 locations in Fresno. We are now in 9 locations within Fresno County, 1 in San Joaquin County, 2 coming up, 1 in Napa County, and 1 in Madera County. So it is very replicable. It is very scalable. We just started the ENT pilot in January of this year. We've already enrolled 1,563 participants in the ENT pilot this year.
Mr. Stillman and Mr. Addison, there's a little bit of time left, but what advice would you give the members of this subcommittee and the full committee as we look toward reauthorization next year on the Farm Bill as it relates to the SNAP program and the WIC program?
Well, I'd keep it simple. Let's not break what's working. Let's focus our attention on some additional outcome-type orientation. I know there were questions asked earlier about things like a work participation rate. As a TANF side of the house, it makes me cringe to think about the output measures that are associated with that, but I do understand the need for public accountability. So let's identify some outcome measures that we can all agree to. I think further integration with the workforce system, particularly where we can rely on intermediaries, whether it's the Fresno Bridge Academy, Seattle Jobs Initiative, where we can use intermediaries that are at the community level to emphasize how we deliver those services. If you can help build an infrastructure that influences us, motivates us, pushes us in that direction, and still leaves us some room for local creativity, that's what I would urge you all to consider as you move forward.
Mr. Anderson, can you answer that in 10 seconds?
I agree with Mr. Stillman.
Perfect. There you
My
go.
time's expired. Thank you, Madam Chairwoman.
Thank you. The chair recognizes Mr. Yoho for 5 minutes.
Thank you, Madam Chair, and I appreciate you guys all, everybody being here. This is such an important topic, as we know, as we go into the next Farm Bill, and we need to take what's working well, refine it, and make it work better. Mr. Weber, the Fresno Bridge Academy, you said it's an 18-month program, it's self-enrollment. How do people sort themselves out? Is it by want?
I'm sorry, I didn't get the last part of your question.
How do they determine to go into that? Are they encouraged to go into that?
Yeah, we basically recruit them and we sell the program to them, and but they, in the end, they have to decide that they want to make this difficult transition. And it's very clear to us that we don't have to do the difficult work of navigating the hard pathway from where they are to where they can be.
So these are the more motivated people that want to
There is a self-selection process that is involved in this thing, yes.
Are you finding a certain age group demographic? Is it, younger families? Is it a family per se? A nuclear family, and I don't want to define a nuclear family for anybody, but it's a family structure that works for them, or is it a single individual?
I would suggest to you that it is all over the place.
Okay.
It is all over the place. The average age of our participant is 35 years. But it ranges all the way from very young,
As you're screening people to go into the program or that decide to go into that program, what traits are you finding people are looking for? Do they have certain, people skills or technical skills, or is it just a strong desire or want to change their lot in life?
I think it's motivation. It is a strong desire to change their lot in life. Now, I should tell you that a lot of the people that we talk to are people who are deeply depressed. They don't like the conditions of their lives. And so it is not like they are, they're chomping at the bit to do something. They're desperate. This is the last line of assistance that they have, and they're desperate to try to change their lives. Primarily, that is true where they have children.
I can remember those days because I was in that lot, and I didn't want to stay there. Yeah. You've got a 30% of the people that come out of that, 30% become self-sufficient in an 18-month period of time.
That is correct.
That seems incredibly successful.
It is.
And then you've expanded to how many different locations? 9, did you say?
We have 9 sites in Fresno County. We're opening up 3 sites in other counties within the one we've already opened, 2 are opening in October.
And when you say it costs you $1,800 per graduate, that's the cost in your program. Where does that funding come from?
That is SNAP E&T funding, 100% funding, as well as some 50-50 funding.
Okay. And then, let's see, I'm going to blow this up here. You were talking about, Mr. Weber, I wanted to ask you another question here. In your testimony, you mentioned the Bridge Academy offers a wage subsidy for the employers. Can you go into more detail about how and why Academy is doing this? And I guess the big thing is providing subsidies sustainable long-term?
Yeah, good question. Let me first point out that the results that I have reported today are for the traditional Bridge Academy service that did not include wage subsidies. Under the ENT pilot, we have requested authorization to offer wage subsidies. We have requested that because, particularly for some of the hardest to hire people, we have to compete with TANF people who do offer, do get
Right.
wage subsidies. And so that was an issue for us. Having said that, the wage subsidies that we are offering are much lower than those of TANF because, quite frankly, we are highly motivated by the notion of doing a program that is very cost-effective and that produces good returns for taxpayers. And so we're driven by cost-effectiveness.
Well, and it sounds like you're doing a good job on that. And at 18 months, I assume those subsidies are gone or they're starting to wean off.
The subsidies are gone within 6 months.
Okay. And I think that's a good investment. Mr. Anderson, out of the 6,100 people that applied for your program and it went down to 2,100, what accounted for only the 30% roughly participation? Is it, again, it's the motivation of the individual?
It is the motivation of the individual. We do try multiple times to get the individual to come in for an orientation and talk with them, 3 letters, several phone calls to try to get them in, and those that just don't respond are the numbers that we reflected.
And then so many times, you get in a meeting like this or, you hear up in the news that, one group wants to take benefits from somebody else. We don't want to do that. We want to empower the people to let them know they're needed. We need people, everybody working. We want to empower their lives so that they have the quality life that they can achieve in this country. And, as you guys have already given us a lot of information, as we talk to people, that's really where we want to go and empower people to get in, move up, and get out. And so I appreciate you all being here. Thank you for your time.
Thank you. Mr. Ashford, you're recognized for 5 minutes.
Oh, thank you, Madam Chair. I agree, and thank you for being here. This is incredibly important. I spent a number of years as an executive director of a housing authority in Omaha. We face these issues every day, and I applaud all of you for what you're doing. And we've discussed in this committee on various occasions the idea that, how far we take people to a certain point, the cliff occurs, and they're afraid to jump off because of fear of losing security, food or housing or childcare, whatever it is. And that seems to be the challenge we all face on the federal level is what can we do to mold federal law. I have spent some time in Washington State and seen, in my years in the Nebraska legislature, I worked quite a bit on juvenile justice reform and have been incredibly impressed by what the holistic approach that Washington State takes to evidence-based remedies for some of these juvenile justice issues. But I apologize if this has been asked or answered, but I guess I would like to know, again, could we just go down the line, starting with Mr. Stillman, if you were to say to me, what changes in federal law and the Farm Bill should we make to address, make this more commonplace, this attitude of breaking down the silos, make it more commonplace and incent states, because certainly our state in Nebraska, we should be accessing the federal funds that are available to get into these, to make these programmatic changes. We're not doing that. So in some sense, Nebraska needs to take the initiative. But what changes in federal law would you all, or what could you see the federal government to ease this process?
One thing I'd say immediately, and that is should be structurally obvious from the answers that we've given up till now, has to do with the challenge that we face when we're working within our silos or having to, as the Bridge Academy does, reach out and talk to people after they've been to one place and another place and another place. And although data sharing is sort of overused these days, I think what we need to focus on are the barriers to a common intake process where our clients, our customers, are not expected to go from place to place to place to place in order to participate in these programs. That onus is on us, but I would say is also on you to identify those places where, because of the funding streams, because of the private and information restrictions that are built into federal law, where we're really hampered by the opportunity to seize the moment when the clients are in front of us. So that would be one thing that I'd urge you to think about carefully and be happy to talk about more in depth at some other time.
Thanks, Mr. Stim. Mr. Anderson.
Yes, Congressman, thank you. I think one of the most important things for us is that we don't make changes to federal law that will ultimately hamper the state's efforts to do this. Georgia specifically is working with the Seattle Jobs Initiative group. I don't know if you're familiar with them, to try to find ways to get non-state and non-federal employment dollars to support the 50-50 match on moving the education and training program forward to try to put more people into jobs and long-term self-sufficiency. So we're already moving in that direction in Georgia to try to look at that. But I think the biggest thing, and I want to bring up what Mr. Stillman has said before, is it's extremely important to try not to mirror the work participation rate that's in the TANF program and the ENT program, because if you look at what's going on, even though it's a great goal, it's a great objective, there's a lot of states that have trouble meeting those goals because each individual is different, each individual's needs is different, they have different barriers that may have to be addressed, and those are kind of hard to get to in a statewide number.
Thank you. Mr. Weber?
Yep. Congressman, as you know better than I, there is no absence of anti-poverty programs in the federal government. The problem is that most of those programs are very siloed. They're very fragmented. And so anything that can be done that encourages innovation, that is driven from the family up, that is to say where public-private partnerships can collaborate on outcomes-oriented approaches such as have been described today would be a tremendously beneficial thing to do.
Thank you.
I would echo what has been said about alignment between programs and the right kind of outcomes and the right kind of public-private partnerships, but just really add that subsidized employment is a missing piece here because we want people to be in real jobs with real work experience.
Right. Thank you. This is very helpful. Thank you, Madam Chair.
Thank you. The chair recognizes Mr. Gibbs for 5 minutes.
Hi, thank you. Thank you, Madam Chair. Thank you for being here today. It's important to get people to find meaningful work and support their families and self-respect and all that. Recently in my district, I held a roundtable discussion on possible SNAP reforms, and we had all different types of entities in there. And one thing that came out that was people that work with SNAP recipients. They talked about the trouble that a lot of their constituents have with literacy programs, budgeting benefits, and handling their finances in general. Does any of your state E&T programs include financial literacy training? If so, what kind of results have you seen? So that's open to anybody wants to answer. Mr. Weber, I see you getting ready.
Yeah, absolutely. Critically important. A lot of the people that we deal with don't even have bank accounts. We have partnerships. For example, we have a partnership with Wells Fargo in Fresno County where they provide financial literacy. And of course, it's in their best interest because then, they're encouraging people to set up bank accounts with them. Maybe shouldn't have mentioned that in light of the recent history with Wells Fargo, but nevertheless, there it is.
Anybody else want to? Mr. Stillman?
I would just echo what was said before. It really is it's life skills, whether they are about literacy or financial literacy, are really critical to that. It's about building the foundational skills that you need to move ahead, to plan, and to have enough bandwidth to withstand some crisis down the road. And so talking about and building that is really important.
Okay, I guess I'll just go, Mr. Stillman. There's multiple organizations we've seen with, working in, so, duplication, with all the different organizations and that you deal with. How do you coordinate the co-enrollment with various programs so you don't have duplicating services? And we've heard a little bit about the silo issue. How do you, coordinate that so we get the most bang for our buck and most efficiencies?
Well, we're very fortunate in Washington to have a fairly robust information technology backbone, and we have don't ask me what it stands for, EJAS, and it is an IT backbone that allows multiple participants in the process, meaning our labor department, our State Board for Community and Technical Colleges, our own staff, to essentially communicate across this system. So first, we start with a comprehensive evaluation to understand what our clients' needs. We do that evaluation on a routine basis to try and update what is needed for that family or individual, and then have this backbone system to be able to properly communicate. And that's really critical among all these silos, that we do more than just an every now and then interaction.
So we want to make sure that we have programs in place, the incentives there, so don't have the duplication when we look at the next farm bill, I guess.
Yes, and if we're all using the same measures and the same system to communicate with, we can drive out some of that duplication. Also,
Mr. Stillman, in your testimony, your employment rates have increased to 61% over the last 2 years. What accounts for the 40% of the participants that didn't gain employment? What's keeping them from getting a job?
Well, the many tens of thousands of people who participate are all throughout the state, and so our communities are not all the same. There was questions earlier in testimony referencing areas of high unemployment. So Washington is blessed to have mountains and oceans and really good stuff, but we also have big urban settings and then many more rural settings where we have high unemployment rates. So some of that lack of job attachment is really due to the fact that there aren't as many opportunities out there for individuals to...
That leads me to my next question. My next question was, in rural counties, there might not be the job opportunities, and you just stated that. How does it work when you're looking at availability opportunities to help these recipients in job training programs? Do you kind of look in their area where they met in their locale, what's available, and try to tailor those job training programs to what's available? And, because it could be different in Washington State. I know there's a big difference from the eastern part of the state and the western part of the western part of the state. So do you kind of look at that, at what's available, and tailor those job training programs to that locale?
We do, and in fact, that's one of the reasons that the utilization of the community-based organizations and the community colleges is so critical, because each of those colleges in Washington are centers of excellence around particular industries or particular sectors, focusing on the need of that particular area, whether it's water issues, salmon restoration, aircraft and other manufacturing. We have these different centers where we're really trying to build the capacity not only of the individuals, but build the capacity of the community to support the employers that have made a decision to invest in that local community.
Good. Thank you. You go back.
Thank you. The chair recognizes Ms. Luan Grisham for 5 minutes.
Thank you, Madam Chair, and I want to thank the panel. clear that this committee in a bipartisan effort really wants to make these benefits work in a way that assists people to move out of poverty. I'm in the unfortunate situation, every one of these hearings, to, if you don't already know, remind the panel that New Mexico finds itself in a really difficult situation where we have some of the highest poverty rates, highest food insecurity rates, highest unemployment rates now in the country. And given that oil and gas continues to be unstable and low, which is one of our large, in addition to ag, economic sectors, it's been really challenging. I used to work in state government, and one of the most successful programs that we ran at the time was an employment program for older folks. So it's the Older Workers Program. We sort of reinvented it, much in the way, Mr. Stellman, that you describe your partnerships and the successes in Washington. The key is that we were very careful about mandates versus voluntary aspects, recruitment and training and participation, and a real productive relationship with the economic sector or the business sector. Now, that's fallen apart in the state. But I'm interested, really, do you have advice twofold? One, for states that find themselves in the situation that New Mexico is in, and two, add to that overarching challenge that it is clear and public knowledge that New Mexico has been mismanaging its SNAP program for decades, that it's taken decades to get a federal investigation, that a district court has now required an independent advisor, and the state's real effort here with the threats of losing the administrative match for SNAP is still to go after beneficiaries. And there's no doubt in my mind that there are some issues with beneficiaries and fraud, small, but they pale in comparison to mandatory work requirements, no investment in education, employment, training, no incentives, no policies in the Farm Bill that really put states both in a proactive and an accountable mechanism to move people off poverty. What advice do you have for me in my state?
That's a tall order. Let me start with that.
That's why they have a tall congresswoman.
I want to go back to the client. I think that's where we all need to begin. We need to go back to the family, go back to the individual, and understand where they're coming from, and ask ourselves whether the service delivery that we have today is meeting them where they're at, as opposed to trying to, put that proverbial square peg in a round hole. So that would be the place that I would begin. I also referenced earlier how important I think it is in Washington that we do integrated service delivery, meaning that we're, again, looking at the entire client. As they present themselves to us, we're not trying to look at this piece of data or that piece of data. We're really trying to dig a little bit deeper. Yes, we need your demographic information, but we need to understand the circumstances of your children, whether there are mental health or developmental issues that are brought to bear, and then design an intervention that is about that need at that time, and then follow through.
I actually completely agree with you. How would you envision that getting into policymaking that creates the right balance so that, for example, if you have mandatory participation in these programs, sounds great, right? If you say, if you will lose a benefit, that's an accountability measure if you don't come to an appointment. But I have two developmentally disabled children, twins, with an underfunded special education component, a 10-year wait on the DD waiver, and they're sick. And I can't get to that appointment because I'm it. And my choices are leaving those developmentally disabled children alone at home sick, or meeting that missed appointment requirement. And the fact that most states do not have integrated systems for universal applications, triggers to make sure that if you're eligible, even though we've said that in federal law, if you're eligible for this benefit, this Medicaid benefit, then you're eligible for these other benefits. And yet we are fighting, and there are many court actions around the country saying, is your state really doing that? What's the right incentive to make sure that states are moving in the direction that Washington has made? And what can this committee do to assure that that becomes the standard bearer in the Farm Bill?
Well, you mentioned earlier that you're not a fan of coercive actions against clients. At least I interpreted your opening statement in that regard. And I think trying to coerce states to do things is equally as challenging. It's an organic system. We're people too. So forcing us to do something is not, I think, the right answer. Incenting us to do things, for example, that family that you referenced, they probably have a medical home. Those kids may have the opportunity to go to an education location or a childcare or respite location. And if there are places where that family is going already, then let's look at that opportunity to bring in and bridge service delivery there and not expect mom to do 10 things, which she can hardly do one thing to help make sure those kids are safe. That's how I would go about trying to address that problem in
And
your
I'm out of
state.
time, and I really appreciate that. And I know that the chairwoman's really worked on cliff issues, but you've just described that you'd have to choose between those benefits in most states. Thank you.
Thank you. Chair recognizes Mr. Thompson for 5 minutes.
Madam Chair, thank you so much for, for hosting this hearing. Thanks to each member of the panelists for bringing your expertise here. I wanted to follow back around on the employment and training components of SNAP. We have so many families, so many people that are living in poverty and find themselves in need of support. And quite frankly, I see employment and training as an exit ramp to poverty. Many of our poverty programs we have almost been like an anesthesia. It's meant to make you feel more comfortable living in poverty versus providing an off-ramp. And so, I'm pretty pleased today. Later today, this afternoon, we will have on the floor a bill that I've been working on for a number of years. It's the Strengthening Career and Technical Education Training for the 21st Century. I wanted to share with you just a couple of the bullets of that and get your assessment what you think about whether this improvement, it's a reauthorization, but it's really a modernization of the Perkins Act. I think it's a transformation of it. Whether you in your assessment, whether this will help the types of people who you are working with and each and every day in terms of employment and training related to SNAP. This change provides a workforce alignment. It actually brings business and industry to the table, so that when we provide training, at the end of the day, it's not just completing education, it's a family-sustaining job that is there. It is really focused on high-wage, high-demand positions that we know are out there in every community, but there's a skills gap between folks who need a job or a better job and those employers that need that number one asset that they have, which is a qualified and trained worker. There's easier access to the dollars for states and for the districts, for the providers of this training. Quite frankly, it reduces the application bureaucracy and requirements to facilitate that. I'll be honest with you, there's less Washington and there's more state and local level, closer to the people who have the need in terms of authority and decision making. And it does push career awareness down into the early middle schools, which I know we have a lot of kids that are being served, but this is an investment for the future, I guess. And so I appreciate the time I have left hearing from you. Does this sound like, are we on the right course for this vote this afternoon?
So I have to say that I'm not as familiar with the specifics of the bill, but the principles that you've laid out seem very sound to me. I think that anytime I can help you solve a problem that helps me solve my problem, it's that classic win-win. And so with employers and industry at the table, with articulating their needs in a way that we can advance the interests of our clients to fulfill those needs, clearly that is a win-win. I will say that high wage and high demand jobs are relatively few in number in contrast to the very large number of individuals that participate in SNAP and even in our TANF program. So sometimes that seems like the nirvana of where we want our families to go, and we have to remember that we have a large number of families in our communities that need some very basic attention before they get to the top.
And the hope is this restores all the rungs on the ladder of opportunity. that we all start at the bottom and climb our way up.
I couldn't agree with you more.
Congressman, I would, from what I've heard, and again, I'm not familiar with the bill, but I would strongly support the principles. I think we all have to understand that addressing poverty starts with the families. And it starts with connecting them to employment opportunities that are available in their local community. This is something that, we don't know sitting in Washington. We know it locally. And then there's a question of connecting those two pieces. What is the training that we need to provide to these people, both in hard skills and soft skills, to get them from here to there? And so what you're describing, I think, would be very helpful in that direction.
Mr. Anderson?
I agree with both the fellow panelists on this one, but just as a principle, the more you allow states to provide input and what works for their state is certainly welcome news for our state.
All right. Thank you, everybody. Thank you, Chairwoman.
Thank you. Chair recognizes Congressman Molinar for 5 minutes.
Thank you, Madam Chair. And I want to thank all of you for being here and your testimony. And I came in kind of at the tail end. I had another committee meeting. But I know that you had spoken about some of the work you do partnering with different community organizations, community colleges, the private sector. And I just wondered if you could be more specific in terms of how those partnerships work. Is it something where you provide the funding, they provide a service? Is there a shared responsibility? And how do you reach out to the different organizations? And all would welcome any of your input.
Sure.
Mr. Weber.
Thank you, Congressman. We work with, we started the Fresno Bridge Academy in 2010 with 14 service providers, all of which had their own sources of funding to provide some of the services that families needed. Today, we're at 175 service providers. With one exception, they all have their own sources of funding. What happens what's happened in the war on poverty in the last 52 years is we have all of these siloed programs. They come down in silos from the federal government. They tend to remain in silos coming down from the state government. And frankly, even at the local agency level, at the local government, they tend to be compliance oriented. What needs to happen is you need to start from the family up, figuring out what it is that is needed, and then making the connections to these families. So the single most important role that we play in the Fresno Bridge Academy is we have what we call a career and family navigator that is assigned to a family from the day that they enroll in the program until they graduate from the program 18 months later. The role is to help them develop a individualized family plan, connect them to service providers, and then support them as they get on the on-ramps to this pathway that they have to traverse. And very, very importantly, help bolster their confidence as they traverse the pathway, because a lot of them, poverty's hard. They've been beat down pretty hard. And so, it's amazing to see their self-confidence grow as they get their GEDs and as they complete their vocational training, as they get into their first job and so on. So that's the way we do it. The one exception is we have a contract with our Economic Development Corporation to help us place our graduates with companies that have 50 or more employees because they have the relationships with those companies.
I can just briefly telescope out. So, of course, the hub of the program is with the SNAP program, in our case in California, the county, in some cases at the state. And in those counties, to respond to the needs of the employer market and the employee population, you often engage a range of contracts with your community college, with your Office of Adult Ed, with Goodwill Industries, with a prisoner reentry program that has a targeted, and all of those folks are bringing match dollars to the table to match with the SNAP E&T, that you have a diverse portfolio of services to serve, again, match your employees with your employers. So that's how we absolutely rely on the public-private partnership to be locally tailored.
And in our state, one of the things that I think we've done a little bit differently is through our employment pipeline, identified medium and large employers that have high turnover in moderate and high jobs. So I won't name names. I didn't ask them ahead of time about that. But essentially look at turnover and look at that cost center that employers are experiencing. It's expensive to hire, train, hire, train, hire, train. So how might we help screen? How might we help train in a way that we use federal and state resources, local community resources to help that employer with their sustained need for employment, and then deliver job-ready employees, and then stay with them as their employment continues, so that they can not only get that first job, but get a better job. And we have to look at some unique industries. People might not think of call centers as an industry, but there really is an industry sector there that goes all the way up to the federal government having some pretty decent jobs in call center-like settings, where if we can help a person start out at a low level and work their way through that, developing good customer service skills, good problem-solving skills, they will have a career that is meaningful.
And in our, one example to add is a major hospital, which also has a nice administrative ladder, a lot of clerical entry, but then a real career ladder there for folks, and a lot of slots.
And in Georgia, part of what we've done with this grant is look at job forecasting and job marketing across the state to see what jobs are coming up and available, and we're actually doing assessments of the individual to see if they might fit that criteria for any of those jobs, and actually going through and asking them the questions and doing a systemic way of finding out what jobs would be best for them. So that's part of what we're looking forward to and the outcomes of our grant.
Okay, thank you very much. Thank you, Madam Chair.
Thank you, and I want to thank folks for being here today. I just think that this was an amazing amount of information that continues to point us in the direction of moving forward and continuing to always look for ways, even outside of the box, to continue to shape and mold these models that we're looking at. I've learned so much listening to you all today, and I really appreciate it. And I think that, it also gives us, for the first time, good evidence-based research coming right out of your areas, the states that you represent, which I think is going to be incredible for the days ahead. So I just want to thank you for your remarks. Thank you so much for indulging us today. Under the rules of the committee, the record of today's hearing will remain open for 10 calendar days to receive additional material and supplementary written responses from the witness to any question posed by a member. This hearing of the Subcommittee on Nutrition is adjourned. Thank you.